Ellen White. It says that through the agencies of nature, God is working day by day, hour by hour, moment by moment, to keep us alive, to build up and restore us. When any part of the body sustains injury, a healing process is at once begun. Nature's agencies are set at work to restore soundness, but the power working through these agencies is the power of God. All life-giving power is from Him. When one recovers from disease, it is God who restores him. This quote is from Ellen G. White, Counsels on Health, page 168. As I said earlier, we are discussing today the COVID-19 vaccine. We have two guests, and all of them will be via Zoom. And so the first guest I have, I'll introduce him, is Dr. Ajay Treme. He's a junior faculty and clinical assistant professor at the University of Arizona College of Medicine, Phoenix. Dr. Treme, how are you doing, sir?
I'm doing very well, and a good evening to all your viewers and listeners.
A good evening to you as well. I know that from where you are, the cases of COVID-19 keep rising. How has it been for you?
It's been a very tough time for all of us, especially health workers. We've had to plan two different surges. The first surge was in June, July, and now we have the second surge that we had to plan for. So we had to call like all hands on deck. We had to switch over schedules to make sure that we have a lot of workers. And then as the surge continued we lost a lot of workforce to the virus. So in that sense, you have to step up and cover for other people who were not able to work. So it's been a very tough and challenging times for all of us.
Right. And then to my next guest, he's in the person of Mr. Daniel Kofi Poku. He is someone who got infected with the COVID-19, and he's here to share with us his experience and how he overcame or he went through the recovery process. For the sake of the program, I'll be calling him Mr. KP. So when I say KP, you know, is one of my guests. Hello, sir. You're welcome to the show.
Thank you. Thank you for having me.
How has your day been?
My day has been good. I'm recovering and I'm taking things slowly. So that's manage myself at the moment.
I can see that. Right. So we start off with Dr. Treme. Doctor, I would like you to give us a brief overview of the COVID-19. We want to look at, I know a lot of people know about it, but I want us to do a refresher to remind ourselves of what the COVID-19 virus is, and then what are some of the signs we should look out for?
Okay, yeah, that's a good question. So coronaviruses have been with us for a long time. It was detected in the late 60s, 70s. And initially, people even didn't believe it was real because they thought it was just a flu vaccine that the person who was looking into the microscope might have picked it as a different virus. So it wasn't believed initially until it was actually proven that, no, this is a different virus. And it got its name coronavirus from the word crown. So because of the spikes on the virus, that's how it came to be called coronavirus. And we've had over 6 different types of coronaviruses in the past. And like 4 of them have been causing common colds. So in medical school, you learn about coronavirus causing just cold. And I think most of us growing up have picked a common cold from coronaviruses. But then in 2003, we had a problem with one of them. That was the SARS coronavirus 1, which caused a kind of an epidemic. And fortunately for the world, it didn't spread so much. It was contained before it could cause more havoc. And then in 2012, we had the MERS coronavirus that again also came up, and it was controlled because it was more in the Middle Eastern region, and we were able to control it. But in 2019, we all started hearing from Wuhan, China, that there is this virus that is causing problems. It's very similar to SARS-CoV-1, and it's causing a lot of people to be admitted into the hospital, and some people are dying. I remember we had a lot of discussions about it. At that time, late December, early January, it looked very far away from all of us. We thought it was in China, it would be contained, until it started becoming more global, and WHO had to declare it as a pandemic in March, and it spread all out. So that is where we are now, from something that we are kind of used to as a common cold virus, to now becoming a pandemic that is spreading. And it's thought that bats are the main animals that harbor some of these coronaviruses. And actually, WHO says that we have over 200 novel coronaviruses in bats. So we might not be seeing the end of coronavirus epidemics if we don't change our lifestyle or change something.
Thank you for that, Doctor. So let's look at the signs and symptoms. A lot of us know about it, but if you can just go through for us, and then if there has been any additional signs as far as research is concerned.
Yeah. So yes, there are like common cold. A lot of people. So let me say, some people, when they get a coronavirus infectious disease like the 2019 COVID-19, they don't get symptoms. So we call them asymptomatic COVID patients. And unless you test them, maybe by accident, or maybe because they were exposed and you were doing contact tracing, you test them and you pick up the virus. And then there are the symptomatic ones. And the symptomatic ones, mostly people will have the common cold symptoms, the cough, they will have fevers, they may have chills, they will have muscle aches and body aches. There are other symptoms that are non-specific, because it's not just coronavirus, like people having GI symptoms like diarrhea, and also people having loss of smell and taste has been one of the few symptoms that have been recorded recently among a lot of people who have coronavirus, like if they lose their sense of smell and also taste. So that's one of the things that we've added. And I was reading the Ghana Journal of Medicine, and they interestingly had one article on the demographics in terms of the Ghana population. And they realized that most of Ghanaians who present with the COVID-19 infection comes with cough, and they come with headaches. So fever wasn't a very common symptom when it comes to Ghanaians. That's if they studied it in about 250 people who came to the hospital. But it doesn't mean that all other people don't have fevers. But the commonest cause from that article I read was cough as number one. So that is where we are in terms of the symptoms. So it may be very non-specific, but most of the time, if you start having a cough, you are feeling short of breath, you can't breathe well, and then you have to go to the hospital, and you will be tested for that, because that is part of the case definition for coronavirus infectious disease 2019, or the SARS-CoV-19.
Right. Thank you for that, Doctor. I want us to also look at the treatment. You know, if someone experiences these symptoms, what is the person supposed to do?
All right. So the symptoms, especially if this person starts having just mild symptoms, it depends on the age and the risk factors of this person. And also it depends where you are located. If you are located in a rich country or in a country where we don't have access to newer forms of medications. So we started the treatments, because it was a new virus that no one knew about, we had to do experimental treatments. So we started with hydroxychloroquine. I think you heard about that,
Yeah.
where people initially treated with that. And then we also added ceftriaxone just for treating pneumonia in general. But then we realized that we could do a lot more studies, and we did some randomized control trials, which that is kind of the gold standard for helping us choose which treatment works and which treatment doesn't work. So when they did some of the trials, they realized that the hydroxychloroquine wasn't effective. So we had to all shelve that. And then we had to now seems to be effective. And then they realized that depending on which patient we have, and if the patient is requiring oxygen or not, that patient might benefit from steroids. And steroids have been in the system for a long time. It's a very cheap medication. And they realized that those patients that we put them on the steroids, specifically dexamethasone, they did very well, and they were not, in terms of mortality benefit, that is preventing people from dying, the steroids helped. So it has become one of the mainstays of treating patients, especially when they start having symptoms, they start having shortness of breath, and their oxygen levels are coming down. We start them on steroids. So that is one of them. And there is a medication called remdesivir that we started it experimenting in Ebola, and then we realized that we could use that as a treatment as well. That we also use. That hasn't shown a lot of significant mortality benefit, meaning it hasn't shown that when we give that, people will not die, but it has shown to reduce the length of increase will be lower. And because of that, you'll be able to then give some of these, the same medication, but with a different company producing it at a much cheaper cost, because the workforce, the labor, and everything, the regulatory, all the things that will make a drug expensive, it has been removed. So that's why we have the opportunity to then get a cheaper form of remdesivir to serve our people who are not as well off as in the developed countries. So it's more of them trying to say, let us help by seeing if we can reduce the cost. But because if they sell it at a cheaper price, the market forces us in such a way that people will go and buy it at a cheaper price and then come and sell it in the United States at a higher price.
Yeah.
So they have to put in regulations such that you can't come and sell that cheaper drug that you got. It's not cheaper because it's not quality, but it's cheaper because they decided to help reduce the cost, so that people will not make profit out of a benevolent gesture or a goodwill gesture. So that is why they made specific markets do specific remdesivir to help serve the people.
Right, doctor. Thank you so much. Before we continue, we'll go for this quick break. When we return, the discussion continues. Please stay tuned. We shall be right back.
Verse 25, God called Moses to the top of the mountain, and he showed him the whole business of the sanctuary.
And let them make me a sanctuary that I may dwell among them.
If it had not been for sin, the sanctuary would have been in heaven alone.
When sin came and we were separated, what God had to do was to bring man back to himself. And that is what God did through the sanctuary.
It is through the sanctuary that we have gotten what we know today is our temples, our synagogues, and all the names that you can make out of.
What in the world is happening to our churches? A sinner who is coming before God to ask for forgiveness, and you are dancing and jumping
In the name of
praising
God,
him. Praising him. When angels are prostrating. If we want to find God, we have to go through the sanctuary, because he is in the sanctuary.
Join us as we bring your way with the message of the gospel in symbols, the sanctuary.
The Sanctuary Trumpet. You will not want to miss an episode.
Hello and welcome back from the break. If you just joined us, we are discussing something about COVID-19, specifically about the vaccine. We've not missed anything at all. We just started and we'll be going in. I have two guests in the person of Dr. Ejay Treme and then Mr. Daniel Kofi Arthur. You can send in your questions or comments via our WhatsApp line 0559680066. We are also streaming live on Facebook and on YouTube via our social media handle, Hope TV GH. You can also send in your questions there and we'll do well to read it out and answer it accordingly. So before we went on the break, we did a quick overview of the COVID-19, and the second guest we have, that's KP. He is someone who had the COVID-19, has recovered, and wants to share his experience with us so that we know that the COVID-19 is very real, it's out there, so we need to protect ourselves. Hello, Mr. KP, if you can hear me, good evening once again.
Good evening to your viewers as well.
Right. I want to ask you, how was life prior to your diagnosis of COVID-19?
So prior to my diagnosis, life was normal. I was going about my normal activities. And at a point in time, I realized something wasn't well in my body. I was feeling general bodily pains, headache. I got some flu at a point in time. I realized I was losing my sense of smell.
Okay.
And I realized things were not going well. But I didn't want to believe it was COVID. So I went to our own hospital, Valley View Hospital, to do a full blood count.
Okay.
After the full blood count, they realized my blood level had dropped. I had H. pylori and some bit of typhoid as well.
Okay.
So they decided to detain me and start treatment on me. That was on 11th of January. It was on a Monday. So they took my temperature and they realized my temperature was around 39, which was very abnormal. So they started the treatment. I was there on Monday. Tuesday, they were treating all of these things. I wasn't seeing any significant change.
Okay.
So Wednesday, my temperature was still rising, and I told the nurses in the evening, I'm pleading with them to refer me to a higher facility because I feel something is wrong. And one thing I realized was it at least occurred to them it could be COVID. But then I had also taken the COVID test as part of the full blood counts I did. That day I took my COVID test.
Okay.
So, can you hear me, please?
Yes, please, I can.
Sure. So, that Wednesday, I was there Monday, Tuesday, Wednesday. Wednesday, I told them I'm begging them they should refer me, and they said it was late. So, Thursday morning, they started the referral process and all of that. And now they started placing calls to some hospitals. And they were like, all the hospitals they are calling, they are saying they don't have beds to accommodate new cases and all of that. The cases were rising and a whole lot of stuff. So I had to call some friends who are medical doctors who were able to, pull strings to secure a bed for me at Ridge Hospital.
Okay.
And they dispatched their ambulance to pick me up from Valley View. They took me to Ridge, and when I got to Ridge that day, my COVID results were ready, and I tested positive on that day. So they straight away, they knew I was a COVID patient, and they took me to the IC, and treatment started over there. I think I must commend the caregivers at Ridge. They really did a great job. They really did a great job. During my stay over there, they really did. I was overwhelmed by how they treated me. You understand? And all our other patients over there. So I got there on a Thursday. They started the treatment. Ideally, I know I was told I'm supposed to be there for 2 weeks. But I think after like 8 days, I was on oxygen support. They were giving me the medications and all of that. After like 8 days, they tested and I was negative and everything was okay. They asked I should come home and continue treatment at home. So I came home last week Friday, and I'm having some slight challenges, and I've been advised it will take a while before I can be fully fit. So the slightest activity, I get tired.
Okay.
So now I don't engage in lots of stuff. I just try to manage myself and rest a lot so that I can gain enough energy and bounce back to normal life activities. So that is how my situation was. And I thank God for how far He has brought me, and it's been a great battle. But through it all, God has been good. God
Sure,
has been good.
sure. But do you know how you got exposed?
It's you see, I've been trying to figure out where exactly I picked this virus from, but it's difficult because number one, I'm particular about the usage of the face mask, and I don't let my guard down easily. But I quite remember I attended, let me say, a party somewhere in December between Christmas and Boxing Day thereabouts.
Okay.
I quite remember at a point in time, my face mask, I think I let it down at a point in time. I'm suspecting it was just around that time that probably
You picked
I picked the virus. Because all my life, I mean, at any point in time, when I step out of the car, my mask is intact. But at that party, I realized at a point in time, I think I got carried away or something, so I lost it. I lost control of myself. I'm sure that is when I picked it.
All right, so for how long did you experience your symptoms before visiting the hospital?
Okay, so I think I experienced the symptoms between 7 to 10 days before I went to the hospital. And even going to the hospital, I felt it was just a fever or malaria. So I was trying to do self-medication. I started for some days and still I realized it wasn't working. That's how come I even went to the hospital. I wouldn't have gone to the hospital in the first place.
Okay, so how did you receive the news when you were told that you were COVID-19 positive?
Okay, so you see, like I said earlier, I went to the hospital to do full blood count. I was thinking it was something different from COVID. So when they told me it was typhoid, H. pylori, all those combinations, it was, I took it like it's normal. So I was okay with it until I realized the condition wasn't changing after all the medication they were giving me. That was when I went online. I was reading about COVID, symptoms of COVID, and I realized the high temperature thing was a key factor. So my temperature was always around between 38, 39, 38, 39, which is not normal. And I realized it was one of the symptoms of COVID. And at the time, I had lost my sense of smell, and I had a little bit of cold. So I psyched myself and I told myself, you know what? They told me to take about 3 to 4 days before the results comes out. So when I realized my temperature was rising, I just told myself, you know what? I know this thing is COVID, but I don't know why the doctors and nurses won't start treating me immediately, and they are waiting for the results to come before, because always my temperature is 38. You ask me to go and wash down, you give me paracetamol, and I'm not really seeing any changes. You understand? So I had already psyched myself, and I knew this thing could definitely be COVID. So I was just ready for it, and I was just waiting for the treatment to begin. So I had psyched myself before even the results came.
Oh, okay. So apart from the fever and then the loss of sense of smell and taste, were there other symptoms you experienced?
Yeah, bodily pains and stomach upsets.
Okay. All right, we'll come back to you. Let's talk to Doctor, continue with our discussion with Dr. Treme, if you can hear me.
Yeah.
Right. Our brother has spoken to us about his experience, how he came about and the symptoms that he experienced. I want us to talk about the new variant. You know, we've been seeing in the news, reading it elsewhere, that there has been a new variant of the virus. If you can talk to us about what that means.
Yeah, definitely. Yeah, and AP, thanks so much for sharing your story. And it's when you have people coming forward and sharing their stories, that is when people will begin to believe this and take this seriously. And so it's important that we have people who have survived this come out and share it, so that if someone is going through some of these symptoms, they will go to the hospital to be tested and help prevent the spreading of this. So COVID variants, so far we have, so I was listening to the president in his update, and he said Ghana has had reported the two variants from the UK and South Africa.
Yeah.
So as with viruses will continue to mutate, meaning they will change their structure as they infect one person to the other. They change, but most of these changes don't affect things much. They don't, even when they mutate and they change small in their genetic structure, it doesn't change how they affect people in terms of how it's spread and all that. But we realize that there are certain mutations that once they change to that mutation, they adapt mechanisms to either spread faster or kill people more. So that is why we call them the variants. So we have the different variants that are there, and the prominent ones that we have are the UK variant and the South African variant. The UK variant has been touted, especially by the Prime Minister of UK, as having most likely will affect how it causes death. Meaning many people will die of the UK variant because the virus has mutated in such a way that it has been able to cause more severe disease. And so if you have the UK variant, it is being reported that most likely you have a higher chance of dying than if you didn't have, if your coronavirus wasn't from that new variant. So that has caused a lot of worry to the United Kingdom and also the world in general, because if a virus has mutated in such a way that now they can spread more and kill more people or get more people on the ventilator or severely ill, then that is worrying. And then there is also the South African variant, which also it's known to also spread very quickly, because they realized that South Africans were getting a lot more of the infections in this second wave. And so but for the South African variant, the scientists there are saying that they don't think it is causing severe disease or severe illnesses. These are all preliminary assessments, so it might change. We might learn that, oh, now it's causing more death, or now it's like the UK one is not as likely to cause more death. But what does it mean for Ghana as a country? So once the president said that we've recorded the South African, the UK variant, it meant that we have to begin asking ourselves if we have that variant in the community itself. Is it possible that we already have people who have passed through our ports and come to the community to interact with people and have already spread these variants? It's a possibility. So there have been surveillances that are trying to pick up whether we have actual community spread of these variants. There are possibilities that we may be having that, but for now we don't know. But just because of how we interact and the fact that we have opened our borders and flights are coming in and out, chances are that we may have that variant. And if truly it causes more death, then we have a problem at hand. And one of the things that the president also reported was that it's getting, the trend that Ghana is seeing is getting a little bit alarming, in that 200 cases a day, and just on the 22nd and on the 23rd, I think, we recorded almost 600 new cases. So that is worrying. Are we also having our own variants? We can't tell. I think there are still studies that they are trying to see if we are having a different variant that might be spreading much more than the previous one. And he also said that there are a lot more people sicker on ventilator with this current surge than the previous surge, where people were mostly asymptomatic. So now the people who are having the symptoms are more. The people who are requiring hospitalization are more. The people who are requiring to be on ventilator or are termed as severely sick are also more. So that is worrying. We don't know. We haven't picked the community. We haven't picked the fact that we have the new variant in the community yet. But from the way things are going, we have to take all the precautions. Otherwise, we might be overwhelmed, and the system might not be able to handle that.
Thank you so much for that, Doctor. Let's go back to Mr. KP. I want to know how your family and friends accepted you once they got to know that you were infected with the virus.
Well, with my immediate family, it was a big blow. It was a big blow, and they were finding it difficult to understand why I should have the COVID. But I mean, they can't just reject me, so they really showed me love, and I decided not to tell some of my friends, a few friends that I trusted. I shared with them that this is the situation I'm going through. So I'm at the intensive care unit. So they may not get to speak with me often. We could text, but I can't be speaking with them on phone because I needed to save enough energy. Whilst I was on the oxygen support, I didn't have that energy to be speaking a lot on phone and all of that. So I had a few friends I was texting and sometimes video calling. They would be speaking and I'll be nodding and all of that. So most of my friends didn't even know I had COVID. It's just a few friends who got to know I had COVID, and they were praying with me. They were praying with me and supporting me. So that is how I managed it with my friends and my family.
Okay, but do you live alone?
No, I live with my immediate family, my mom and my sisters.
Okay, so how did you quarantine yourself, or when you came home?
Okay, so when I came home, I quarantined myself. I tested negative before coming, actually.
Okay.
So when I came home, I decided to be all by myself for some time, trying to, manage myself like all alone for some time. So after like, let's say 5 days, I started my normal activities with them at home. But I tried to keep a distance, and always now the usage of face mask at home is mandatory.
Okay.
Previously we were, but now we all try to keep a distance and use face mask because you don't know who next is carrying the virus. So we all need to protect ourselves. So that's how we've been managing ourselves at home.
Right. Were you at any point stigmatized by family or friends when you came home?
Well, there's nothing like stigmatization so far. I was a bit traumatized when I was at the intensive care unit.
Okay.
I was traumatized because I know COVID is very deadly. But the very first night I entered the ward, in the ward that I was, 2 patients died.
Wow.
I just couldn't come, like how they died. It was just like a split second and they were just gasping for breath, and that was it, they died. I saw it with my naked eyes.
Wow.
So I was asking myself, I was also on oxygen support. So I was asking myself, so am I going to also go this way? And the nurses realized I was traumatized psychologically. So they needed to move me from the ward to a different place. Unfortunately, the ward they took me to, someone died over there, and
wow.
It wasn't easy for me. It wasn't easy for me. So they were working on my psyche. They were trying to inspire me, and they were telling me everybody comes here with his or her own issue. Some have underlying conditions. You don't have underlying condition, and it's possible your recovery process will be different from someone else. So don't be looking at what someone else is going through and think probably you will also be suffering the same fate. So they really did well. They were psyching me up and all of that, and they were expecting me to be there for about 2 weeks, but I was at the ICU for, let's say, 8 days, and I had to come, which they were even amazed. It's not normal for them to have patients stay there within just a week and they discharge the patients. But I think it's an act of God too. It's an act of God.
That's right. I want you to share with us your experience when you were on the ward. How was a daily routine like? Maybe the doctors come around, they give you medications. How was it like?
So daily rotation, in the mornings, they will come and take your vitals, they'll check your SpO2 oxygen level, they'll check your sugar, and they'll be giving you medications, and they'll be checking your vitals, and from time to time, when they realize probably there's an improvement in your condition, I think they start changing your medication and reducing your oxygen intake level. And when I went there, they told me I'm there to be weaned off the oxygen support. So I shouldn't think I'll always be on the oxygen support, because if that is how I'm thinking, I'll be there for long. So the very first night I went there, they increased the level for me, and they started dropping it gradually. And you need to psych yourself and work on your lungs and ensure you're taking enough oxygen without the oxygen support, so that when they take it off you at any point in time, you can stand. So that was how they were managing us over there. So in the morning, they'll take your vitals, they'll give you your medication. If you are due to take medication in the morning, they'll give it to you, your vitamin C, your zinc, and some infusions and other things. That one there, it's a bit of the medical side, so I don't know much about that. So they'll give you morning, afternoon, evening. So at a point, I realized I was done with all my courses, so I was only taking medications in the morning. And they were doing some physio. And at a point in time, when they realized when I was weaned off the oxygen support, now they gave me access to fresh air outside. So sometimes in the mornings, they allow me to go out to benefit from the morning sun and also breathe in some fresh air from outside. After a while, they bring you in, you go take your shower, they give you your breakfast, you eat when lunch is due, they give you your lunch, correct meals. That one, I think they were doing well. Correct meals, per 3 square meals a day.
You enjoyed.
They were really doing. I enjoyed, right. And they were really showing us some sort of love and care.
Okay.
They really did well.
Okay.
The nurses really did.
Okay. Now let's go back to Dr. Ejay Treme. Doctor, we want to talk about the COVID-19 vaccine. Okay. So what are the types of vaccine we have in the system currently?
Okay, so very good question. So vaccines in general, just to explain and recap, vaccines are just biological preparations that we prepare, and it provides a form of active immunity. And this is targeted at a particular disease. For example, with the coronavirus disease 19, we have developed, currently in the United States, we have approved 2 vaccines.
Okay.
In the UK, there is the AstraZeneca vaccine that has also been approved. In the United States, it has not been approved yet. So vaccines, by its nature, is supposed to give you an active form of immunity, meaning that it's going to help your body so that your body produces its own defenses. Okay. And that once your body produces its own defenses, your body memorizes the defenses that it has produced, so that when an actual disease comes to your body, because your body has memorized the defenses, it fights this new disease that is coming. So that is what vaccines are supposed to do. And the vaccines that we currently have, one of them is the Moderna vaccine, and the other is Pfizer in the United States. So these 2 are very similar, and they are very a new form of technology that we haven't used in the past. And it's a very groundbreaking or kind of revolutionary technology in terms of going forward when it comes to vaccine preparation. And why are we saying that? This is because it's called an mRNA vaccine or messenger RNA vaccine. And these are made in such a way that they go in with a message to your cells, the cells in your body. And when they go into your cell, it tells your cell to produce something like your defenses against the spike protein that causes the COVID-19 symptoms. So once it tells your cell, it doesn't enter your nucleus. So the nucleus is where you have your DNA structure and everything. It just works around in the cytoplasm, meaning around the cell, around the nucleus. And it doesn't go into the nucleus. And then it tells that the body produce these antibodies so that it will help fight any new infection that comes to you. And so once it finishes its messenger job, the body clears it out. So it doesn't last in the body for a long time. And this is novel because we are able to now give them specific messages. So for example, Moderna just told us that the South African variant, they realized that their vaccine is able to still protect you against the South African variant.
Okay.
But out of the abundance of precaution, they are going to send a new booster. And that booster is targeted at giving the cell the message that, okay, now there is a variant that you should also learn to protect yourself against. So that the booster vaccine that you are going to get will then protect against the South African variant, if that is what you get infected.
Okay.
So that is one of the things that has been very revolutionary about these new vaccines, and that has given us a lot of hope, because we realize that we will be able to give our body specific messages to produce its own defenses, such that it will be able to fight diseases. The last one is the AstraZeneca vaccine, which is it uses an older technology. It uses a virus, adenovirus from kind of chimpanzees, and because humans have not been exposed to that kind of group of viruses, we haven't produced any defenses to that. And because we haven't produced any defenses to that, we will not be able to, our body is not already trying to fight that. So once they give you that vaccine, your body will then produce the messenger RNA, and that messenger RNA will then tell your body that produce these antibodies and put it in your memory, such that when you now face the new COVID infection, you'll be able to fight it. The main difference between that and the two I already mentioned is that the AstraZeneca vaccine could be stored in normal refrigerator, unlike the Pfizer and the Moderna vaccine that needs specific fridge to keep the vaccines still very good for use. So those are the main differences, and hopefully with that kind of technology, I think we will be able to get to where we will give ourselves specific instructions, and they will be able to fight newer and more terrible diseases that we have. But again, when it comes to a new technology and a new vaccine production, it comes with its own myths and its own suspicions, and people begin to spread a lot of falsehood about it. So what I want to say is that this kind of, though we call it a new technology, has been in existence for 17 years.
Okay.
But the whole point is that because we didn't have a pandemic of this nature, there wasn't enough funding. Not many people were ready to volunteer themselves to be used as for the clinical trials, and there wasn't the edge to actually facilitate this technology until we got to this point. And now that we are in the pandemic, we could make a faster, a much more improved and an efficient way of developing this vaccine. So that's why we were able to, within a short time, produce this. But it doesn't mean that this technology is entirely new.
Okay.
So that's with the vaccines that currently we have.
So, Doc, how many shots is an individual expected to take?
Okay, so so all the 3 vaccines that are in production, you need 2 shots, and you have to. So for the Moderna and also the Pfizer vaccine, you will need to take it 3 weeks apart, within 21 days or not more than about 30 days. So there is that. That's how the trials were done. The AstraZeneca vaccine, though they gave that gap between like a month gap, but now because of the fact that the UK is being overwhelmed, there were talks about should we just give a lot of people the first shot and then spread out so that a lot of people will be covered with the first shot and spread out the time that we have to give the second shot. So that is also based on availability of the vaccines, which country you are in, and their specific protocol. But in general, you get 2 shots of the vaccine to have maximum protection. So for the first shot, when you get a first shot, you are protected. For the Pfizer especially, you are protected like 50% of the time. So you have a 50% chance that if you are exposed to the virus itself, you might be infected. But when you get a second shot, you'll be protected about 95% of the time. But when you are exposed to the virus, 95% out of 95 out of 100%, there is the chance that you will be able to fight this virus and you will not get any symptoms. But when they did the study, they also said that you are 100% protected from having a severe infection if you get the shot. So all the people who were in the clinical trial who got the vaccines, they never got severe illness. So even if you are unfortunate to be in the 5% and you get the illness, you are 100% protected from having severe illness where you have to be in the ICU, like Kim was saying. So those are some of the differences. And the AstraZeneca one, it gives you a range between 60% to about 90%. And they realized that they did the trials in 2 different countries. So they did one in Brazil and one in the UK. The UK one, out of maybe a mistake or something like that, they decided to halve the dose. So the first dose that you got was half, and then the second dose was the full dose. And they realized that it gave a very strong immunity and a protection of the 90%, even more than when they gave full dose and full dose as in the Brazil one.
Okay, Doc, so are there any recorded side effects of the vaccine? And if there are, would that mean that because of the side effects, people should reject the vaccine?
That's a very, very good question. So like everything, any drug you take, even food, like anything will have its own side effects if it's not taken appropriately, or it's and all the drugs that we have in our markets have their side effects. When you read the labels, it's listed. But we always talk about the risk benefit. So the risk of you dying of COVID or having severe infection of COVID or missing your job or your livelihood because of COVID is way, 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 way higher when you have the actual infection. But they realized that when they gave the vaccine, people had mild symptoms. And most of the people I know, and I have a personal experience because I have vaccinated, I've got my 2 shots. My first shot, I just only got a sore arm, and that was it. The second shot, I had just a very brief episode of chills and then some tiredness, but it wasn't enough for me to even prevent me from going to work or going about my normal activities. And I've known a lot of people who have been able to go through this without any issues. But there are other people who might have to miss work because the symptoms may be a little bit more. So they might have the same fevers or cough, or just because the vaccine is giving your body a message to produce immune response or to produce like a defense response. Some people react differently, and their defense may be a little bit more, like their response to the vaccine may be a little bit more, where they may have a more exaggerated symptoms of the chills, but almost all of them will last between 24 to 72 hours. You should return to normal. If you are not going back to normal, then that is worrying. And these side effects, when it was evaluated by independent bodies, including the FDA, the UK group, they all felt it was safe and effective, and there have been significant peer-reviewed scientific data that suggests that it's safe and effective, and compared like 2 months safety data compared to all the previous vaccines we have are very similar in terms of safety and efficacy.
Right. Thank you so much, Doctor, for that. I want to go back to Daniel, Mr. KP. If you can hear me.
I can hear you.
Yes, so I want you to share with us, once you came home, how has your life been? What has been the routine for you since you are recovering?
Okay, since I came home, I have decided to take some 2 weeks bed rest. So I don't engage in my normal routine activities. I don't do my normal work schedule. I rest a lot. When I wake up in the morning, I take my medication, and I try to catch the morning sun as well. And I do some little exercises. And I sleep a lot. I sleep a lot lately, just to gain much energy back. So that has been my routine since I came from the intensive care.
Okay, and how has the support been from family and friends?
Well, the support has been great. The support has been great. They've really shown me lots of love. They've shown me lots of love. So now I literally don't do anything at home.
Okay.
I have to be calling on them to, give me my breakfast, lunch, and supper. Ordinarily, sometimes you would have to go to the kitchen and sort yourself out, but now when you just place a call, they'll just bring everything you need and they support you small until a point when I'm fully recovered that I can do all of these by myself. Yeah. So I get that support from family now.
Okay, thank you so much. Now, we are just about wrapping up. I want you to, since you've been through it, I want you to advise us, the general public. I know that a lot of people are not taking the disease seriously. People think it's just something working somewhere which doesn't concern them. But now, since you've come out, we've seen that it is real and we need to speak about it and talk to people about it. So in your own words, what do you have to tell us? How serious is it, and then how should we protect ourselves?
For the seriousness, I think it's much more than serious, if there's a word like that. I've taken it upon myself to become a COVID ambassador and also to let people know how serious it is, how deadly it can be, and also encourage people to mask up all the time. Because it's better to be healthy and live a normal life than to go through the stress of being kept somewhere on oxygen support and being mentally traumatized and seeing things that on a normal day you won't be seeing.
Mm-hmm.
So I've decided to take that upon myself. When I am fully fit and I go to church, I'll be talking to my friends at church. My workplace, I'll be sensitizing people, the hand hygiene, the wearing of the face mask and all of that. I think it's much easier to do those things than to fall sick and go through the stress of all of that.
Yeah.
So I've taken it upon myself to let people know of all of these things and conscientize them.
Right. Thank you so much. Let's go back to Dr. Treme. We are wrapping up. I want you to give us your last words about COVID-19 vaccine and then the prevention. And then if you have any other piece of advice to give to us.
All right. Yeah, thank you very much. So it's a disease that took the world by surprise.
Mm-hmm.
The scientific world was overwhelmed. And this is a disease that actually the Times magazine just did a 2020 magazine, a full cover, and they crossed out 2020. It's a year that people want to forget because of this virus. So it's very sad when people don't take it seriously. When people sometimes you don't have to experience something before you know it's deadly. You have to learn from other people's experiences, and that is the smartest way to do. And that is what I am urging and encouraging people to do, that you don't have to get this disease because you don't know what it will do to your body. Everybody responds to the disease differently. There are people who were very fine. There are people who were younger that we thought they will survive it, but then they get it and they get the symptoms. We have people, we call them the long haulers, where they have the symptoms, prolonged symptoms. And I have friends that have had it and they are still coughing 2 months into it. 3 months, they are still having the cough. They are still struggling to breathe. And in a system like Ghana, where our healthcare system is already stretched to its limits, and we don't have a lot of ventilators, we don't have enough oxygen for people to even use. It's kind of also helping the society itself by taking care of yourself. Because once you take care of yourself and you prevent yourself from getting the disease, you are helping us save resources that otherwise would have used on you to help other people who are sick. And again, when in a pandemic like this, we tend to then focus all our resources on people who have the COVID, because that is what is currently urgent. Leaving people who need other treatments hanging. And it's known that a lot of people have died from other conditions because of COVID, the healthcare system is stretched, and we have to channel the workforce into managing COVID. So that is why Ghana has an opportunity, and we have a good opportunity to help stem this kind of infection so that we will save our healthcare from collapse. Because if we are to experience what is happening in the Western world, and if this South African variant is anything to go by, and it gets into the community and it starts spreading as fast, and if we are to be recording the 200 cases every day, I don't think, and most people are becoming symptomatic, I don't think we have a healthcare system that will be able to support such things. So let us all protect ourselves. They are very simple measures that we can do. Wear face mask everywhere you go. Anytime you come into contact with other people, you should have your mask on. When you are speaking, that is not the time to lower your mask. No, you have to keep your mask on to cover your nose and your mouth. They are simple things. Make sure that you don't also turn your mask upside down and wear it differently at different times. Otherwise, you might inhale the virus because you have already exposed the outside surface of your mask. And ideally, it's better to wear a surgical mask than the cloth mask. But if for nothing at all, if you have the cloth mask, it's better than not wearing any mask at all. So let's use that. Let's keep our bodies healthy, exercise more, get the sun, go outside, breathe healthy air, and let's continue to eat well, eat good food. Fruits and vegetables more in our diet, and less of the fat and less of the, I know fufu is our what we all love, but we need to begin to shift towards eating more healthy, eating more fruits and vegetables, making sure that we are having a very healthy weight, because obesity, hypertension, diabetes, in and of itself will make you have a higher chance of dying or having a severe form of the COVID disease if you get it. So that is important. And another last thing about the South African strain is that it's also been recorded that people who have already been infected with the COVID-19 still could have reinfection from the South African variant in a very short time. So initially we thought that you are protected maybe at least 5 months or 6 months before you might be reinfected again. But South Africa is realizing that people who have been infected previously couldn't mount enough defense for this new variant. So now that this new variant is could possibly be in our system, we have to make sure and take good care of ourselves. The fact that you've had COVID before doesn't mean you should not be wearing masks. And I like what KP said, that the family is putting in measures. They've been wearing masks even in the house. And that is a very good thing, because you don't know which variant you will get again. And you don't know how the toll it will take on your body. So even those who have had the infection, they shouldn't be going about saying, oh, I've had it, so I'm protected. We still have a lot to learn about this. And together, if we all take good care of ourselves, we will be able to fight this. Vaccinations have been a lifesaver in the world. It has helped us eradicate smallpox. It has helped us eradicate polio in many countries. And it has saved us from a lot of deadly diseases, hepatitis B and other things. When people are vaccinated, it protects them from having liver cancer. So vaccines are nothing new, and it has helped save the world. And this is another opportunity where together, once we get a safer way of vaccinating a lot of people, we will be protected, and it will make this virus go away so that we'll be able to get as close to our normal activities as possible. So that is what I want to share with Ghanaians and your viewers out there, that we can do this. We can keep ourselves and fight this virus, and so that the future will be bright for ourselves, our communities, for all the people we love.
Thank you so much, Doctor. I've been interviewing Dr. Ejay Treme. He's a junior faculty and clinical assistant professor at the University of Arizona College of Medicine, Phoenix. And then our brother Daniel Kofi Poku is a survivor of COVID-19. Gentlemen, thank you so much for joining us via Zoom to educate us on the COVID-19. And to you, our viewers, the COVID-19 disease is very real, as was outlined by our brother. And so, please, as you go out, protect yourself. The disease is not gone yet. Please put on your mask, wash your hands regularly. If you don't have running water and soap, you use your alcohol-based hand sanitizers. And then if you go to a social gathering, please maintain your distance. And together we can fight the COVID-19. If the vaccine comes to the country, please do well. We all go in and take it to help the recovery rate. And I know that by this we can all fight together and then overcome the COVID-19. This has been Healthy Living. My name is Bibi. Thank you so much for joining us. We'll be on your screen same time next week from 8 p.m. to 9 p.m. on Mondays. May the Lord be with you. Take care and have a good night.
Right. Have a good night.